Hello everyone, this is Chadi Alraies from NCVH in 2023. I'm really privileged today to be with one of the co-directors, Dr. Amit Amin. We're going to talk today about radial to peripheral intervention. I mean, thanks for meeting us.
Yeah, thanks for having me. I've got a talk coming up pretty soon about radial and peripheral interventions and how we can use it effectively and have great outcomes. And so, these as the trend is, it's a small percentage that's gone towards radial pedal approach, about 5%, and hopefully we're trying to get that more of a mainstream. But the cost implications, the ease for the patient, now the devices are getting better. A lot more companies are coming out with a lot more catheters and equipment and balloons and stents. Long enough for us to reach, and the patients love it, especially in our OBL setting. They're absolutely just head over heels, coming back and say, whatever you did, is so much better. The comfort was there. They don't have to, lay down flat for multiple hours. There's no what we call groin precaution, so they don't have to, worry about bending over, squatting, lifting anything heavy. It's just a radial band. They're put on post-op, and they're out the door within a couple of hours instead of prolonged stays.
So you mentioned 5 minutes acquisition right now, or the practice 5 minutes, 5% only radial right now. So what is the barrier when it's taking off right now?
So that's a wonderful question. I've been asked that multiple times. I think a lot of it's education. I think that's the biggest part. I think a lot of people don't think it's safe, so we're waiting for more trials to come out. So I think the safety part is a big issue, and it should be. In our practice, we've proven it. It's extremely safe. Our complications rate for radial access is extremely low, if not none.
Do you think it's comfort? Because we're used to do femoral all the time, and now we can switch similar to the coronary femoral to radial kind of switch?
I think so too. I think historically everybody's gone femoral. And then, back in the day when coronaries went radial, it was like, hang on now, I'm not going to do that. But now it's mainstream. And I think it's just that matter of time before we switch over to the radial side from the groin, which is understandable.
Yeah, you mentioned something about equipment, and now we have more kind of equipment that's radial friendly,
Yes, sir.
and we can reach more. So you think our inventory is ready now for somebody to switch his practice or her practice to radial?
I think to start, yes. I think there's still more to go, and from what I've been hearing, the companies are listening now, and they're giving us the equipment that we desire. So yeah, you could do a very good job right now if you wanted to start implementing stuff, yes.
Especially above the knee,
especially above iliacs and SFAs for sure, common femorals like the couple of cases we just had. Infrapopliteal, they're getting there. We've got everything we need, but we're waiting on a few imaging devices to get longer and go from there. Otherwise, we'll have the complete package.
I think you can argue dorsal axis can be compared to radial axis, almost kind of safe. And
it's very comparable. They're small. It must be, hopefully they're bigger than 2 millimeters. But access-wise is very similar. The only caveat is that pedal access is a little more challenging because the foot is not flat like a radial, right? So you have an easy target, but if you get a posterior tibial, the foot's going to be to the side. The patient may not be able to do that. If it's dorsalis pedis, you have to worry about the arch of the foot. So a little bit of nuances that part, but roughly about the same.
Okay. So for all the listeners out there, so we should acquire more radial. And I think the industry is there available. And I think as long as you plan the procedure and you have the equipment in the lab, I think it's doable and easy to do.
I think so too. I totally agree.
Thank you so much for your time, Dr. Amin. Please watch these videos and others on NCVH YouTube channel. This is Chadi Alraies from New Orleans. Thank you so much.
Thank you, sir. It's really happy. Thank you very much.
Thank you.